Hello and welcome to today's episode on family dynamics and substance use, with a specific focus on British culture. I am Shalini Emmanuel, a clinical psychologist, and it's a pleasure to have you here. Substance use is a challenging issue that many families face, and today we'll explore how family relationships can either contribute to or help prevent substance misuse. We'll also look at the practical strategies for improving communication, building supportive networks, and recognizing the early signs of substance use. Now, did you know that in the UK, drinking culture often plays a significant role in shaping family dynamics and societal norms around the substance use? Our goal today is to provide you with tools and knowledge to tackle these challenges and promote healthier relationships within your family. Now the question is, how family relationships influence substance use behaviors? So let's start by discussing the connection between family relationships and substance use. Family dynamics play a significant role in shaping substance use behaviors, either as a protective factor or a risk factor. Now, in the United Kingdom, research highlights how family support, parental influence, and home environment contribute to the likelihood of substance misuse. Now, understanding these relationships can actually help to create effective preventive strategies and support systems. However, we need to understand the role of family in substance use as well. So, the first is parental influence. Parental behaviors strongly influence children's attitudes towards substance use, whether through direct exposure or indirect messaging. Parents shape their children's beliefs about drugs and alcohol from an early age. Statistics have shown that children of the parents with substance use disorders are up to 3 times more likely to develop similar issues. A 2023 study by the United Kingdom Addiction Treatment Group found that 62% of the young adults in addiction treatment had at least one parent with a history of substance misuse. The Alcohol Health Alliance UK found that parental drinking habits directly influence children's alcohol consumption, with teenagers in the households with heavy drinkers being twice as likely to binge drinkers. Now, a National Institute for Health and Care Research (NIHR) report stated that children from homes with absent parental supervision were 75% more likely to experiment with substances before the age of 16. Now, the Strengthening Families program in UK is designed to improve parent-child relationships, and that has been shown to reduce alcohol and drug misuse among teenagers by the 40% when parents actively engage in their children's lives. Glasgow's Parenting for Prevention initiative actually educates parents on their influence over the children's substance use, leading to a 35% decrease in youth drinking rates over the 5 years period time. Family stress and conflict also matters. Now, family stress, conflicts, and instabilities can create the environments where children and teenagers are more vulnerable to substance misuse. Domestic violence, financial struggles, and emotional neglection increase the risk of turning to substance as a coping mechanism. A study in 2023 by the NSPCC found that 60% of children living in homes with domestic violence had also been exposed to parental substance use, and that significantly increases their risk of addiction in their later on lives. Children from high conflict homes are 2.5 times more likely to use substance before adulthood. Now, the UK Office for National Statistics 2023 reported that adolescents experiencing the family breakdowns or parental divorce are 50% more likely to misuse substances compared to those in stable households. Another survey back in 2022 by Action on Addiction UK found that 70% of teenagers who sought drug treatment services reported feeling emotionally neglected at home. Further real-life applications are the Safe Families for Children program, which in England provides support to families who are experiencing crisis, reducing children's risk of substance misuse by up to 30% through mentorship and emotional support. Whereas the London Family Recovery Project, it helps families struggling with addiction and conflict, showing a 25% reduction in youth substance use after 1 year of intervention. Now, there are certain protective factors within the families. Not all the family environments contribute to substance misuse. Many can serve as protective factors that reduce the risk of drug and alcohol use. That might be strong parent-child relationships, open communications, and consistent parental guidance, which actually creates resilience against the substance use. Now, children who actually are regularly eating meals with their families are 33% less likely to use alcohol and drugs compared to those who do not, and that is the study of University of Sussex. Teenagers who report strong parental attachment are 55% less likely to engage in risk substance behavior. Now, another study back in 2023 by the University of Birmingham found that parental monitoring, it's like setting clear rules and being involved in children's social life, that reduces early substance use by 45%. Now, in families where parents openly discuss the dangers of substance use, the teenagers are actually 50% less likely to experiment with drugs. The Family Links parenting program, it is another one in Oxfordshire that teaches positive communication and strategies actually, and has led to a 28% decline in youth in substance use among the participants. Scotland's Whole Family Approach, another program which promotes family-centered recovery and addiction support, has been linked to a 37% increase in long-term sobriety rates among affected individuals. Now, what do we conclude? Families' relationships play a pivotal role in shaping substance use behaviors, while family stress and parental substance use can actually increase the risk. So, strong parental attachment, open communication, and positive role modeling serve as powerful protective factors. Now, by investing in family support programs, we can reduce the likelihood of substance misuse among the people, the young people actually, and promote healthier communities. Let us discuss some of the interventions and family-based prevention strategies. The family-based interventions play a very significant and crucial role in preventing the substance misuse among the young people. Researchers consistently showed that when families engage in prevention programs, the risk of substance use decreases significantly. Now, let's just explore some key strategies that have proven successful in the UK. The first and the most important one was the family therapy, a support program which was introduced. And family-focused therapy programs offer the structured support to address the underlying issues contributing to the substance use. However, these programs help strengthen the relationships, improve the communication, and create a stable home environment actually that encourages that discourages the drug and alcohol misuse. The other one is multi-systemic therapy and functional family therapy. Multi-systemic therapy is an evidence-based intervention which is actually diagnosed to support the families which are dealing with the youth substance misuse and delinquency. Whereas the functional family therapy focuses on the strengthening family dynamics and has been shown to reduce the drug use by improving the problem-solving skills and reducing the negative interactions. Now, MST has been linked to a 60% reduction in youth drug-related arrests in UK communities where it is implemented. So the implementation is very important. Whereas the FFT has shown a 40% decrease in repeat substance use among the teenagers who participate in therapy with their families. Again, the implementation is important. Now, a study by the University of London back in 2023 found that the adolescents who completed a 12-week MST program were 50% less likely to relapse into substance misuse within a year. However, FFT has demonstrated a 35% improvement in parent-teen communication, conflict resolution, directly reducing the substance experimentation among young people in UK. Now, in Manchester, the MST interventions in schools have led to a 45% decline in drug-related expulsions, which is a great achievement. Whereas FFT programs, when they are implemented in London, have seen a 30% improvement in family cohesion, helping at-risk youth avoid early drug use. Now, NHS and charity-led family counselling services are also to be taken in notice. So beyond these structured therapy programs, the NHS and various UK-based charities provide crucial family support services as well. And these include counselling sessions that help families to navigate the challenges related to substance use, trauma, or conflict. The NHS Family Counselling Services actually provides family-based counselling programs that are designed to address the emotional and psychological aspects of the substance use. So these services are often offered through local mental trusts and community outreach initiatives. The NHS's Better Health Every Mind Matters campaign includes the family-based strategies which was planned to prevent the youth substance misuse. So according to the NHS Digital Mental Health Survey of 2023, 70% of the families who engage in counselling see improvements in communication and emotional regulation, thus reducing the likelihood of substance misuse. So now the point is that children who receive early family interventions through NHS programs are 55% less likely to develop the substance-related problems later into their life. Now, another survey of UK Drug Policy Commission report found that family counselling services reduce relapse rates by 40% among young people completing the substance use treatment programs. Now, important thing is charity-led support programs. Organizations like ADFAM, Action on Addiction, and We Are With You provide tailored support for families affected by substance use. Now, these are the charities or the organizations that offer one-on-one counseling, peer support groups, and workshops to help families cope with addiction-related challenges. ADFAM's Family Support Program has helped 80% of the participants report better coping strategies in dealing with the loved one's substance use. And that was a report of 2022. Now, families engaging with We Are With You's services experience a 50% increase in their ability to provide emotional support to the young people or the young ones that are struggling with the substance use in their family. A study by the UK Centre for Substance Use Research back in 2023 found that teens whose families participated in charity-led intervention programs were 45% less likely to engage in heavy drinking or drug use. Now in Liverpool, as ADFAM-led project has helped over 200 families rebuild relationships with children overcoming with the substance misuse. Scotland's Family Recovery Initiative Fund (FRIF) has provided financial aid to 1,000 plus families for accessing addiction counselling, leading to a 30% drop in youth substance misuse in high-risk communities. So what do we understand? Family-based prevention strategies are crucial in reducing the substances misuse among the children or among the young people. Now, through structured therapy, NHS services and charity-led support groups or programs, families can strengthen their bonds, improve the communication, and create protective environments for their children. The success of interventions like MST and FFT and counseling services highlight the importance of investing in family-focused solutions to build healthier communities. We also need to understand about the parental education and awareness. Now, parental education plays a crucial role in preventing substance misuse. When parents are informed and actively involved, they can provide guidance and support to their children, thus reducing the likelihood of early experimentation with drugs and alcohol. Now, in the UK, several initiatives focus on educating parents to recognize the warning signs and to foster the open communication. Now, the parent education programs in UK include the AdFam UK, which provides resources and workshops to help parents talk to their children about the substance use. Now, their programs actually focus on reducing the stigma and understanding the addiction and offering the practical communication strategies. Where on the other hand, the NHS Parent Support Program works with schools and community centers to educate the parents about early intervention and harm reduction strategies. Where on the other hand, We Are With You, which is formerly Addiction, runs parental awareness programs in local communities, helping the families to understand how substance use starts and how to address it early. The UK government's Talk to Frank campaign offers online resources and helplines to support parents in discussing the drug use with their children. A study back in 2023 by Public Health England found that 80% of the parents who received drug education training felt more confident while discussing substance use with their children, thus reducing the likelihood of experimentation. Now, the schools that actually implement the parent awareness workshops see a 35% decrease in students engaging in risky substance use behavior. And that was again by the report of UK youth substance use. Now, children whose parents have open conversations about drug and alcohol use are 50% less likely to experiment with substance before the age of 16. The parental supervision and awareness reduces the risk of teenage binge drinking, and it has been reduced for up to 40% according to the Alcohol Change UK report. In Birmingham, community-led workshops have trained over 2,000 parents to recognize the early signs of drug use, leading to a 30% increase in early intervention referrals. The London Borough of Camden introduced a parental engagement initiative that reduced youth substance-related suspensions in schools by approximately 25%. Now, training parents to recognize the warning signs is also very important. And recognizing the early warning signs of substance use, it allows the parents to intervene before the problem escalates. Now, schools and local community centers play a very crucial role in providing training to help parents spot the behavioral and emotional changes which are linked to the substance misuse. Let us discuss some of the behavioral warning signs. They can be changes in moods, they can be withdrawal from the family, they can be declining academic performances or new friend groups and secretive behavior. There are some triggering physical warning signs too. Bloodshot eyes, sudden weight loss, lack of physical hygiene, and unexplained bruises. Environmental warning signs are there too. Finding the drugs, missing prescriptions and medication, and then noticing a sudden increase in secrecy. Parents who receive the trainings on recognized early signs of substances use are 60% more likely to intervene successfully before their children or their kids develop a substance dependency. And that was the research of Addiction Services back in 2023. Community-led parents education programs actually reduce the likelihood of the youth drug experimentation 45% in at-risk areas. If you talk about the schools who are offering a parent education program reports a 28% decline in teenage alcohol consumption. But if we talk about the other real life or real world application, in Manchester, a school parent collaboration program helped identify early drug use in 15% of at-risk students, which is then leading to successful interventions before escalation. Scotland's Known the Sign parental training initiative reduced late-stage substance and interventions cases by 35% in participating communities. We need to understand the strengthening parent-child bonds. The strength of parent-child relationship is one of the most influential factors in preventing substance use. So, when the parents establish trust and set the clear expectations and provide the emotional support, the young people or the children in the family are less likely to turn to drugs or alcohol. The parent needs to understand and encourage the open conversation about the mental health and substance use. Now, stigma-free discussions actually allow children to ask questions and express concerns without fear of punishment or fear of judgment. Now, parents who actually normalize these habits and conversations about stress, peer pressure, decision making, they are actually creating an environment where child or children could feel safe seeking the advice. The NSPCC recommends that parents start talking about substance use before their children reach the adolescence to establish trust. Statistics have shown that the teenagers who have regular and honest discussions with their parents about the drugs and alcohol are 50% less likely to engage in risky substance use, a study by UK Centre for Mental Health. Another study by the University of Bristol in 2022 found that the open conversation about the mental health in families led to a 40% reduction in youth self-medicating with alcohol or drugs. Now, children who get strong parental support are 55% less likely to develop the substance-related issues. There was a survey of London schools which found that the students who participated in parental discussion programs actually reported a 32% decrease in peer pressure-related drug use, and which is very remarkably gained research. In Liverpool, family-led substance use prevention programs actually improved youth resilience, reducing the drug experimentation. About parents need to set the boundaries and expectations. So establishing a household rule around the alcohol and drug use helps to reduce the experimentation. When parents set expectations regarding the curfews, the friendships and the risky situations, children are actually less likely to engage in substance use. And parental disapproval of substance use is one of the strongest protective factors against early experimentation in the children in UK. Studies have shown that the households with clear substance use rules see a 40% reduction in the underage drinking and drug experimentation. And this was again the research by Alcohol Education Trust. The teenagers who actually know their parents disapprove of drug use are 55% less compared to those whose parents do not explicitly set rules. And that was the research by Youth Tobacco, Alcohol and Drug Survey. As far as Scotland is concerned, in Scotland, the schools that implemented parental rule-setting workshops saw a 25% decrease in students experimenting with alcohol before the age of 15. We need to understand that providing emotional support and coping strategies will definitely work for the children. Now, teaching children or students how to manage stress, anxiety, and the peer pressure actually reduces the likelihood of turning to substance as a coping mechanism. And for that, we need to encourage activities like exercises, mindfulness, and creative outlets that helps young people to develop healthy stress relief habits. Parental involvement in children's daily life has shown to act as a buffer against the peer pressure and risky behaviors. For that, several statistics have shown that teenagers who receive emotional support from their parents are 45% less likely to use drugs to cope with stress. Whereas families that encourage and engage in stress management activities altogether, such activities could be exercise or mindfulness or progressive muscle relaxations, and they report a 30% decrease in youth substance experimentations, and that was the research by University of Cambridge. Now, parental involvement in extracurricular activities is linked to a 25% reduction in early drug use. If we talk about further more examples, in Cardiff, the parent-led resilience training program in schools have led to a 28% reduction in stress-induced teenage substance use. However, Glasgow's Healthy Mind, Healthy Families initiative has helped 200 plus families develop stronger emotional connections, reducing the risky behaviors among the young people of the family. We need to understand the community and policy recommendations as well. So, increasing the access to family support services for at-risk households, we need to understand that implementing school-based family programs to educate both children and parents and to prevent the substance prevention is also important. Now, expanding the government funding for family therapy interventions as a preventive measure rather than a crisis response is also very important. We need to encourage workplaces to offer the mental health and family support services to the employees, reducing the stress-related substance misuse. Now, the question that comes here is, how can we improve the communication within families to reduce the conflict and stress? So, poor communication is often at the heart of the family conflicts that contributes to substance misuse. Healthy communications, on the other hand, helps build the trust, resolve the conflicts, and ensure that every family member feels heard and valued. And for that, studies show that the families with strong communication pattern report lower stress levels and better mental health outcomes. We need to understand some common communication barriers in the families as well, and we need to identify those barriers. So before we improve the communication, let's just understand what gets in the way. So the common barriers that comes in the way, number one is lack of active listening. So instead of truly listening, many of us prepare our next response while the other person is still speaking. The second issue is emotional reactivity. Now, heated emotions can escalate the conflicts instead of resolving them. The third one is assumptions and misinterpretations. Jumping to conclusions without clarifying intent. Next is digital distractions. So excessive screen time actually reduces face-to-face interactions and meaningful conversations. Now let's explore ways to improve communication so that families can create a healthier, more supportive environment for every one of them in the family. So the key strategies include, the first one is active listening means giving your full attention to the person speaking without interrupting or judging. So let's take an example. If a family member is opening up about stress or struggles, try to validate their feelings rather than jumping to solutions or criticism. So saying things like, I understand this difficult for you, you can go a long way in fostering trust. The second most important thing we can do is setting healthy boundaries. Healthy boundaries are crucial, especially when addressing the substance use. For example, setting a rule that alcohol is not kept at home or that certain behaviors won't be tolerated can help create a clear structure while reducing the conflicts. Now, the third skill that we can do is conflict resolution skill. When conflicts arise, it's important to stay calm and focused on resolving the issue rather than assigning blame. Now, techniques like taking a pause during heated arguments and coming back to the discussion later can prevent the escalations. The fourth thing that we can do is we need to break the stigma. Now, substance use is still a taboo topic for many families. Addressing it openly and without judgment helps to reduce the shame, which is often a barrier to seeking help. For example, instead of saying, "Why are you doing this?" try, "I am here to understand what you're going through." The role of the supportive family networks in recovery is very important. When it comes to recovery, the family's role is actually invaluable. Supportive networks provide emotional stability, accountability, and encouragement that can make a significant difference in someone's journey to recovery. Now, so far what we have discussed is being a pillar of support is very important. Being supporting or being supportive doesn't mean doing everything for the individual, but rather walking alongside them in their recovery journey. This could mean encouraging them to attend the therapy, for example, or checking in on their progress regularly. The family involvement in recovery program is very crucial. Many recovery programs offer family therapy sessions or workshops. Participating in these only helps the person in recovery but also strengthens the family bond or the family unit. For example, you might learn how to avoid triggering behaviors and provide consistent encouragement through the therapy programs. We need to create a stable environment. A stable environment is actually essential for the long-term recovery. This includes maintaining a predictable daily routine or limiting access to substances and fostering a calm, supportive atmosphere at home. We also need to celebrate the progresses. Recovery is a long journey, and every milestone, no matter how small, deserves recognition. For instance, celebrating a month of sobriety with a meaningful, substance-free activity can boost morale and reinforce the positive behaviors. Now, educating the families on recognizing substance misuse and seeking help is way more important. The early substance misuse is identified, the easier it is to address. However, many families struggle to recognize the signs or feel unsure about how to intervene. Let's look at some practical ways to tackle this challenge. Recognizing the signs of substance misuse is important. Look out for the changes in behavior, such as mood swings or secrecy or withdrawing from the family activities. Physical signs like changes in the appearances or appetite or sleep patterns can also indicate substance misuse. For example, if someone is frequently tired or irritable, it might be worth investigating further. We need to encourage the early interventions. Now, early interventions can make all the difference. This means addressing the concerns as soon as they arise rather than waiting for the problem to escalate. We can take example, if you notice warning signs, initiate a calm private conversation about your concerns. We need to understand that seeking the professional help is also important. There are many resources available in UK such as the NHS and the helplines like Talk to Frank. Professionals can provide assessments, counselings and support for both the individual and the family. We need to understand that family relationships have a profound influence on substance use behavior, shaping both the risk factors and the protective mechanisms. Strong family bonds, open conversations or communications, and parental support can significantly reduce the likelihood of substance misuse, while conflict, neglect, or parental substance can increase the vulnerability. By fostering a nurturing and communicative environment, families can play a critical and important role in prevention and early intervention. It is essential to break the cycle through education, through early support, and seeking the professional help when needed. Together, we can create healthier, more supportive family systems that empower the individuals to make positive life choices. Thank you so very much for joining today's episode on family dynamics and substance use in British culture. So if you or someone you know is struggling with substance use, please don't hesitate to seek help. Resources and professionals are always available to guide you through every step of the journey. Together, we can build healthier families and communities. For more information or to connect with us, you can visit the Awakening Rehab website. Thank you so very much for your time today. Take care.